And welcome everybody. Thank you for coming to Community Water Safety. This event is something that I've been doing for several years since really COVID. My name is Craig Sears. I'm president and founder of GAWSA, which is the Greater Atlanta Water Safety Alliance. I am joined this evening by Dr. Sarah Lazarus, the Pediatric ER Physician. We're very pleased to have Dr. Lazarus with us here tonight. And we're going to get into, she works also at Children's Healthcare of Atlanta. We're going to get into a very important topic of water safety, which includes drowning prevention and a number of other things. So first of all, I would like to do an introduction. So Sarah, do you want to say anything before I start?
Sure. My name's Sarah Lazarus. I'm a pediatric ER physician at both Children's Healthcare of Atlanta and Wellstar Pediatric ERs. And I'm passionate about water safety and drowning prevention and do a lot of injury prevention research as well with Children's Injury Prevention Program through Strong for Life at Children's Healthcare of Atlanta. Thanks for having me.
Yeah, thank you. Thank you for coming on. If you're wondering, this is the first time you've heard of GAWSA, we've been around since 2012, and we initially formed as a chapter of the NDPA, which is the National Drowning Prevention Alliance. And we then registered officially as a 501c3 in 2020 so that we could do fundraising for our initiatives. We are not legal. We are not providing any legal advice tonight. We are not attorneys, so just want to disclaim that. Our mission at GAWSA is to reduce the incidence of drowning as a leading cause of accidental childhood death, to reduce the exposure and transmission of recreational water illnesses, to increase the popularity of recreational swimming, and to advocate for swim lessons, learn to swim programs, and the sport of competitive swimming. So how do we do that? Well, phase one of our mission, which we've been doing since 2012, is water safety education events. And we conduct water safety seminars and workshops for various groups in the community. This is the perfect example of what we do. This is the one big one that we do online each year. And then we do a lot of them at local events as well. And I shouldn't say the one big, because some of the local events are really actually heavily attended. This one picture here was for at Cobb Safety Village for the Hispanic community. And we had, I think, 400 people attend that event. As we have grown our mission outreach, we started with water safety education to the community. We continue to do that. We've expanded to offer the world's largest swim lesson program, where we are a site for that. This year's event will be happening on June 20th, 2024, and we're coordinating with 2 additional sites around the Atlanta area. So if you have an interest in participating in that, please talk to us at the end of the presentation. I'd be happy to tell you more. It's a really, really cool initiative. One of the things that we do at GAWSA is we provide subsidized swim lessons for underserved populations through a network of local swim schools. And we've been doing that for a couple of years now, and that program is continuing to grow. So at this point, I'm going to turn it over to Dr. Lazarus, and she's going to talk to you about what drowning is so that we can kind of reframe how we understand that.
Perfect. So drowning, has a lot of various terms, and the World Health Organization really defines it as the process of someone having respiratory impairment or distress from submersion or immersion in liquid. But despite what many of us think, where drowning equals death, that doesn't necessarily imply death, or even that they necessarily need medical treatment after removal of the cause. There are 3 possible outcomes. So you can have fatal drowning, you can have non-fatal drowning with injury, and non-fatal without injury. Next slide.
Yes, thank you. Yes, obviously we're hoping for the last one there.
So drowning is a process similar to other disease processes. There's kind of a spectrum of injuries that you can get from drowning. And the faster, of course, we interrupt the process, the better the outcome. So the faster a child is pulled from the water, resuscitated appropriately, receives oxygen, airway involvement, CPR if needed, the better the outcome. But the outcome can vary widely. There can be absolutely no issues whatsoever. It could just be mild cough, or it can be quite severe, such as hypoxic injury or brain injury or death. And one of the things that we really struggle with in the literature is that there's so many misnomers for drowning. So you may hear on the news about near drowning or dry or wet drowning, delayed or secondary, but we don't recognize those terms. We really focus on, is this fatal drowning? Is this non-fatal with injury or non-fatal without? And the interesting thing about drowning is if there has been an aspiration event or a submersion with inspiration, then complications usually arise within 2 to 4 hours, up to 6 hours following a non-fatal drowning. But unlike what we hear where 24, 48 hours later, someone gets respiratory distress, this really doesn't occur. Some of the symptoms that we're looking for include persistent coughing, a lot of fatigue or drowsiness, trouble breathing, irritability, chest pain, or unusual behavior. But I think the biggest thing to notice is that really it's within the first 2 to 6 hours after an incident. You can go to the next
Absolutely. All right. Thank you, Dr. Lazarus. So this next slide here has got a little clip to show us what drowning actually looks like, because it's one of the most misunderstood behaviors. A lot of people think that it's very obvious when somebody's drowning, but this is going to tell us otherwise.
An unsupervised child falls into the pool reaching for a floating toy. As they attempt to get to the surface, they go into what Dr. Frank Pia identifies as the instinctive drowning response. Recognizing an individual in this response is critical because they may only be at the surface less than 60 seconds. The mouth is above the surface. They inhale and exhale quickly. Yelling or calling for help will be rare since the instinctive drowning response of the body is to breathe. The head will be tilted back and the mouth will be open. They push down on the water surface with their arms, attempting to keep themselves above the surface. They will vertically bob in one location and not move in any direction. Voluntary movements such as waving for help, swimming, or reaching a rescue support device is overridden by the body's natural defense mechanism to breathe. Remember, recognition of the instinctive drowning response is critical because the individual may only be at the surface for less than 60 seconds, approximately the length of time of this clip.
So I like to show this clip because it really does a pretty good job of clearing up the misinformation out there as far as what drowning looks like. The majority of depictions of drowning that we see in the media today, whether it's movies or TV, shows people waving for help and calling for help. And that's not really a drowning person. That is what we call a distressed swimmer. That's someone who's a competent swimmer but has run into a problem and they're able to call for help and realize that they're experiencing a problem. But once the drowning process starts, instinct takes over, and that's what we see in this video. And so they're not able to call out for help. And that's for swimmers, and that's basically 20 to 60 seconds is what we have for swimmers from the time that they can go from a competent swimmer with no problems to a drowning victim and then a passive drowning victim. But for a non-swimmer, it gets really scary. It only takes mere seconds. So a drowning child or infant or toddler can slip beneath the surface very quickly with no struggle, no gasping for air, no noise. This slide progression here shows how quickly it happens. 1 second, the child falls in. 2 seconds, you can see that their head is tilted back or they're going into that instinctive drowning response. And you notice that the child's lips are closed. They're not calling out for help. They're trying to hold air in. And then within the 3rd second, their face is already in the water. And at that point,
And I think,
sure, go ahead.
Go ahead. I was going to say, I think what's amazing too is it can be in just such a small amount of water. So just 1.5 inches really of water. It doesn't have to be what we're seeing in these pictures, which is a little bit more. It can happen in so little water as well.
Yeah, you're absolutely right. I mean, there have been cases where toddlers have drowned right next to their parents, sadly, and they didn't realize that was happening. Even on the stairs, parents think, well, they can stand on the stairs, but if they take one step too far, suddenly they can't. So this is the alarming truth there. What we advocate for is that swimming should be kids' first sport. And so there's a brand new campaign that the National Drowning Prevention Alliance put out this year called First Sport. And if you haven't seen the video, I strongly encourage you to look for the video online. We're not going to show it in this presentation because it's a little bit longer, but it's a fantastic video that explains why swimming should be every kid's first sport because it is the only sport that can save your life. Also, we like to emphasize you're never too old to learn to swim. We believe everyone should learn. So let's talk about our layers of protection. The first one is supervision. Adequate supervision is vital. Despite what you may think, a lot of drownings, the vast majority of drowning occurs when the guardian is present or around. 70% of that time, or 70% of those drownings occur during a non-swim time. So it's typically when the parent or the guardian assumes that the child is not going to be in the water, and suddenly the child is in the water. I think all of us with toddlers can relate. You turn your head and they're off doing something else. More drownings actually occur in shallow water versus deep water. That's eye-opening for some folks. Even if your pool is lifeguard staffed, it's important for parents to understand that the supervisory responsibility does not end when they enter the pool gate. When it comes to breaking down where children are drowning, most young children are drowning in swimming pools. Most older children and young adults typically drown in natural bodies of water. If you're at an event and a child goes missing and there's water nearby, always check the water first. Sadly, that's sometimes people assume that they wouldn't have gone there, but that's the place that you're going to need to get to them the fastest if that is in fact where they went. So for your non-swimmers, you want to make sure that you are, as a guardian, you always want to make sure that you're within arm's distance for them in the pool, and within line of sight for anyone who is a competent swimmer. Another thing to remember is the difference between toys and life-saving devices. So anything that's inflatable is considered a toy. It's not a life-saving device. And if it inflates, it can deflate. Often gives a false sense of security. So some more drowning statistics that are alarming. I've been at this for quite some time, and Dr. Lazarus is very passionate about this as well. And the National Drowning Prevention has been at this for decades, yet still, it is the #1 cause of death for children ages 1 to 4. And it is the #2 cause of death from ages 5 to 14. Approximately 4,000 people drown every year in the United States. And what's often not talked about and usually mislabeled on the news, with that near drowning term that Dr. Lazarus was talking about earlier, is there are 7 to 8 non-fatal drowning cases for every fatal drowning case that wind up in the ER that go and see Dr. Lazarus. It's also interesting to note that 75% or more of these drowning victims are male. I can't say why. I don't know that we've determined why, but I think we all have our theories that as boys, we tend to do dumber things. At least my wife would certainly agree with that. It's also good to know that racial and ethnic minority groups drown at significantly higher rates than marginalized groups due to disparities in access to the water and instruction. And this has been proven through studies. Anecdotally, we can add that there are also a number of cultural stereotypes and fears that can be passed down generationally that affect individuals' willingness to learn to swim. Most incidents occur during the summer months, which is probably not a surprise, but half occur in a group setting, which is rather alarming when you think about it. It's unsettling to know that people could be drowning right around you, but sadly that is the case many times. I have unfortunately witnessed a number of security camera footage videos where you can see somebody drowning and other people swimming right by them and around them, completely oblivious to the person who is drowning. That's how easy it is to miss. So let's talk about a little bit of diving safety and safety in natural bodies of water. So when you're talking about diving into the pool, for pools, typically it needs to be 5 feet or over 5 feet deep in order to be the diving area. That's pretty much the standard. The only exception there really is for competitive swimming. And in those cases, you should be doing that only under the instruction or supervision of a coach. And then for natural bodies of water, it's important to know that you should never dive in natural bodies of water unless you know for sure that the depth is adequate. You always want to consider the waves and tides. Just because you entered the water at that place yesterday doesn't mean that the water is the same depth today. If you find yourself in a rip current, which is very common, and the graphic here is actually brought to us by Great Lakes Surf Rescue Project, which is a wonderful group out of Michigan. And they put this together to illustrate the flip, float, and follow. And that basically tells you what you should do. If you find yourself stuck in a rip current, don't fight it. You want to just flip over on your back, float out, and follow the current, and then swim perpendicular to or parallel with the shore, perpendicular to the current, until there's a safe spot for you to swim back in. One new thing that Dr. Lazarus and I were just talking about earlier today, and I hope this doesn't become a viral video trend, but I have started to see a few TikToks about this, and it's called, as best I can tell, it's called storm drain tunnel diving, where basically individuals, mostly teenage boys, are going out to culverts where there's a storm drain, and during a storm where there's an excessive amount of rainwater, and jumping in and basically holding their breath, riding through the tunnel or the storm drain and coming out the other side. This is an extremely dangerous, very unnerving thing to watch, certainly to participate in. Please, if you've got teenagers and they hear about this or they're thinking about doing this, caution them against this. There's no way of knowing what's in that storm drain that they could get caught on. Next, I want to talk about beach sand safety for just a moment, because there was a tragic story you may have heard in Fort Lauderdale just a couple of months ago, where a family with a boy and a girl were digging in the sand, and the sand collapsed. The boy was recovered, the girl unfortunately not in time, and she did not make it. I believe she was 7, her older brother was 9. And based upon this, people go to the beach thinking, oh, you really just have to worry about rip currents and dangers like that, or things that can sting you. But the sand can also be fatal. And so experts recommend that if you're at the beach, do not dig holes, or don't allow your kids to dig holes either, that are any higher, or any deeper, I should say, than knee height of the shortest person in your group. And if you follow that guideline, you should be safe from sand collapse. So let's talk about swim lessons and the ability to swim. This graphic is fresh off the right off the press. Just came out within the last couple of days from CDC, and basically showing us the disparity in different ethnic groups and racial groups on who is receiving swim lessons or who's taking swim lessons. So on average, only 45% of Americans have had swim lessons. That's alarmingly low in my opinion. 28% in the Hispanic community, 37% in the Black community, 47% in other ethnic, and 52% in the white community. Swim lessons, though, you can start, in our opinion, you can start as early as 6 months. As soon as you can get your child in. Now, these are typically parent-child classes where you'd be interacting with your infant in the water with the instruction. But we recommend getting them in as soon as possible. There's studies that show that it benefits the children in so many ways that we really advocate this very strongly. It benefits their motor skill development as well as their brain development. And I'm sure Dr. Lazarus could speak to that more if you, I don't know, if you wanted to add anything, feel free to jump in.
Yeah. So the American Academy of Pediatrics really was the first one to come out and say, like, swim lessons. At first they weren't sure when swim lessons could really be started, but it can be as young as 6 months, of course, depending on your child's developmental level and kind of what your comfort level is. And it is very unfortunate that a lot of adults who don't know how to swim obviously are not going to teach their children how to swim. So really, mother and me, father and me, parent and me swim lessons are really a great way to kind of introduce and also build kind of collaboration between parents and children. And the swim lesson study that we're assessing here, it was a pretty small study, but that we have seen there are lots of different benefits to swim lessons.
Mm-hmm. So these next statistics, I believe, came from the Red Cross. They did a swimming competency survey where they interviewed folks and asked them, how competent of a swimmer are you? And they found that people grossly overestimated their swimming ability. So they found that despite much higher numbers of people reporting that they could swim competently, only 64% of Black Americans, 64% of Black Americans don't know how to swim, 56% of Latino Americans don't know how to swim, and 38% of white Americans don't know how to swim. So again, we are a first world country, and this is a major problem. When you go outside the US, these statistics start to look even worse. So let's talk about the 5 layers of protection. This is a model pioneered by NDPA. And this really helps us think about the ways that if we're covering all these bases or as many bases as we can, we're really minimizing or mitigating that risk. So the first one is barriers and alarms. And pool fences or mesh safety fences, that's what's pictured here at the bottom, are very, very helpful. Self-closing and self-latching gates are essential for all commercial pools, but even for residential pools, really should have them. Pool alarms, there's a variety of alarms that are available on the market. There's perimeter alarms, wave alarms, window door alarms, wearable alarms for children as well. Safety pool covers in the wintertime, we highly recommend those. Or if you have it in the budget to have a mechanical safety pool cover that you can, motorized one you can put on and off, that's even better. Virginia Graham Baker compliant suction outlets, we're going to talk about that a little further in a moment. Supervision is the next layer. So there you want to have a lifeguard or a water watcher or a guardian, somebody who is ready and willing to assist if a person is in need. Water competency is the next layer of protection. Make sure you're getting swim lessons for everyone who's going to be in the water. Life jackets around open water, super important. They should be U.S. Coast Guard approved, and they really have to fit properly. So make sure that everyone who is on the boat or everyone who's in and around the lake or the ocean should have one of these on with a proper fit. And then lastly is emergency preparation, CPR and water rescue, and emergency action plan for each facility. So these are things to be aware of that are the 5 layers of protection. Okay, this next video here, I'm going to ask you a series of questions that should pop up here. Yeah, here we go. First of all, how many swimmers do you see? Which one is easiest to see? Which one is hardest to see? Now I'm going to play the video and I want to see if you're surprised. Uh-oh, this video is not playing. I had this problem last week and I apologize. I'll just have to tell you what the video does. So believe it or not, there are 3 children at the bottom of that pool. If you look closely, the one on the left is wearing a neon green swimsuit. He is the most visible. The one on the right is wearing, I believe, a blue swimsuit, and I can barely make him out. And there's actually a girl in the middle between the 2 boys that you can't see until, if the video would play, you see all 3 of them surface at the same time. And it's rather surprising. But this video does a great job of illustrating the importance of swimsuit color and visibility underwater. So think about that when you're buying swimwear for your kids. All right, let's talk about pool drain safety. And Virginia Graham Baker, who went by the name Graham, is pictured here. Unfortunately, she died tragically in a suction entrapment incident in a spa main drain before this law passed, and is the reason that one of the main reasons this law passed. So what you need to know about this is that this law passed a number of years ago. Passed in 2007, and everyone had to be compliant by 2008 for year-round pools, 2009 for seasonal pools. And what that meant at the time, there was 3 steps to becoming compliant. You had to check your drains, your sumps, and your equalizers without going into way more detail than you'd want to know from a pool guy. These drain covers are the most easy way to recognize if at least the facility has taken step 1 and had become compliant that way. So when you're looking at a pool and you're looking at the main drains should not be flat or flush. If they are flat or flush with the surface of the pool, that's the old style grates, and they are not compliant, and they are potentially dangerous. Can definitely be dangerous. And if they have a 3D effect to them where they stick out or stick up from the surface, then those are probably the new covers, the compliant covers. The challenge with these is that they do have a lifespan of 5 to 7 years, depending upon the manufacturer, and it is up to each facility owner to track that. I also should mention that this is a federal law and applies only to commercial facilities. So it applies to, for instance, YMCAs, it applies to health clubs, it applies to homeowners associations, it applies to apartment complexes, hotels, city and municipal aquatic centers, all of these places it applies. It does not apply to backyard pools, which is where the majority of the incidents have happened. It also does not apply outside the United States. Now, the good news is that when the US passed this law, it became illegal to sell the old style grates. So as people are upgrading and replacing their grates, they're going to have to buy the new style grates. But as I mentioned before, that's really just step one of compliance. And it's really the only one that as a regular pool patron, you're going to be able to see because it's visible. The other really has to do with the space underneath that drain. And we're not going to go into that in this presentation. It starts to get too technical. All right, let's talk about a phenomenon called underwater hypoxic blackout. This was previously called shallow water blackout. It's since been correctly identified and updated to and labeled as underwater hypoxic blackout. So what is it? Well, it is a loss of consciousness caused by cerebral hypoxia. It typically occurs with free diving or breath holding pool laps or breath holding games. It primarily is triggered by hyperventilation prior to the breath hold, and we'll explain why that happens in a moment. The key factor here is that people think that you feel that urgent need to breathe from the oxygen level in your blood. And in fact, it comes from the CO2 level in your blood. And that's important because hyperventilating, which is repeatedly breathing deeply over and over again, it doesn't really pack your blood with extra oxygen. It's a very, very minimal effect there. But what it does do is it expels a lot of excess CO2. So it artificially lowers that CO2 level in your blood. And what that means is that you don't feel that urgent need to breathe. And so what can happen is your oxygen level then drops too low and you black out underwater. The picture of the young man here on the right, his name is Whitner Milner. Whitner died of underwater hypoxic blackout. I believe it was in 2011 while he was doing breath holding contest in his backyard pool. And unfortunately, no one was supervising him at the time. Whitner was a highly athletic young man. He was very good at, he was an avid spear fisherman. So he could hold his breath up to 3 minutes and he continuously challenged himself to extend that. And so that's unfortunately what happened is he was practicing that at home without assistance and died. And so experts say that underwater hypoxic blackout is actually the leading cause of drowning for competent swimmers because they don't realize what's happening to them. So the last step there is that when they do black out, they involuntarily take a breath underwater. And if no one pulls them out immediately, then obviously they start drowning. Now, in the Navy SEAL training, they actually do push their trainees to this point, but they are properly supervised medically and resuscitated immediately when this happens. But that's not the case in our pools, and that's why we don't allow breath holding contests in our pools. So this illustrates it graphically, but basically in a normal dive, you would just take a breath, your oxygen level starts to deplete, your CO2 level starts to rise, you feel that urgent need to breathe, you come up, take a breath, everything restores to homeostasis, and we're all good. But in this dive, you hyperventilate before. And when that happens, that you artificially lower that CO2 level. And so it takes longer for the CO2 to creep back up to where you feel that urgent need to breathe. Meanwhile, the blackout level for O2 in your blood is reached and you black out underwater. Closely related to this phenomenon is CPR protocol. I like to make sure that people understand the difference between full CPR and hands-only CPR, because when there's a drowning victim involved, they absolutely need full CPR with rescue breaths. In fact, the breaths are the most important part. And the reason is this, hands-only CPR came out a number of years ago, and Dr. Lazarus could probably tell you exactly when, I don't recall. But the primary reason was that 911 operators were struggling to have bystanders perform CPR on strangers because of the mouth-to-mouth requirement. They didn't feel comfortable doing that. And so they did some studies and determined that hands-only or compression-only CPR was still effective at circulating oxygenated blood in these cardiac emergency situations because the person was breathing right up to the point where they had the cardiac emergency. But in a drowning case, your victim's been underwater. And unfortunately, the oxygen has been depleted out of their blood. And so if you're only doing hands-only or compression only, you're not helping the victim at all. So those breaths are essential for getting oxygen into the victim.
Yeah, and for adults, the number one cause of cardiac arrest is the heart. So by going ahead and doing hands-only CPR and getting quick AED access and defibrillation, if indicated, you're going to go ahead and address that cause. But we know that drowning is a respiratory emergency. It's a respiratory process that leads to cardiac arrest. So it's a different pathophysiology in the case of most of these drownings. There are some rare cases of cardiac arrhythmias that may be cardiac. So that's why it's important that you do. And I actually, this is the number one, really the only, NIH states that you should start with breaths. Usually we start with going ahead and doing compressions, but any CPR is better than no CPR.
True, true. Yes. Thank you, Dr. Lazarus, for speaking more eloquently to that point than me. All right. So the next slide up is about water watchers and lifeguards and what is a water watcher and so forth. So water watchers basically are just a responsible teen or adult who basically stands ready to assist and to watch children in the water. Both roles will watch people in the water and be able to help respond to accidents. Both can enforce basic pool rules. Both should be readily identifiable either by a tag or a uniform. My understanding is that Good Samaritan laws offer protection for both, but this is something you'd want to confirm with your attorney on. Water watchers typically are not going to be trained to perform water rescue, but they could extend something to extend a pole or a tube or something or a noodle to a struggling victim. And they can assist lifeguards as a ready bystander. We encourage water watchers to be CPR certified. Not all of them are, but it's of course recommended for everyone to get CPR certified. And water watchers are volunteers. So this often brings up the question of, well, if they're not on a payroll, are they covered by insurance? And that's kind of a technical question. You definitely want to talk to your agent about that. As I've consulted with insurance companies and attorneys, the advice that I have been given, again, I am not an attorney, but that there is possibility for some coverage under the directors and officers policy if you're in a community or at a facility and the board of directors authorizes and officially deputizes water watchers in your facility, they may be covered under that D&O coverage, but that's something you'd want to discuss with your either your association or your facility. We do have these water watcher tags available at our office for free, and we're happy to send them out anywhere. This product actually comes from Pool Safely, and you can also order them from poolsafely.gov. It's a great product available for free. All right, now let's talk about just pivot slightly away from drowning into healthy swimming. How do we stay healthy when we're swimming? Well, there's recreational water illnesses and or RWIs for short, and they're extremely common in water. So that's why we want to talk about this. And diarrheal illness is also really common. Fecal contaminations are common in water, and these are all unpleasant things to think about as we head toward pool season. But the reality of it is that this happens all the time. The CDC did a study that determined that the average swimmer carries about 0.14 grams of feces into the water with them on their bodies because they haven't, properly showered or cleaned themselves. So that's going in our pools, in our bodies of water, whether we like it or not. It's just happening. And then also, CDC determined that 11% of the population has diarrhea at any given time. So that's a pretty significant percentage of the population. It's very important that we communicate to them that they should not be swimming if they're suffering from diarrhea. Diarrhea poses the greatest threat of spreading RWIs because it can contain so many different pathogens. We also want to encourage our patrons to report fecal contaminations for the public health and safety benefit. I've seen several associations and facilities fine for fecal contaminations, which I understand the rationale there. We want to certainly encourage people to be more responsible and not bring their children in when they are experiencing diarrhea. But the problem when you do that is you're going to incentivize not reporting, and then that's going to create worse issues, actually, health problems. So moving away from the fecal discussion, let's talk about a bacteria called Pseudomonas, which is the primary bacteria responsible for swimmer's ear, which is another thing that we get a lot of questions about each spring as children start swimming again. So what are the risk factors for swimmer's ear? Well, water exposure obviously has to be part of it. The longer that the head is submersed, the greater ability that they could happen. So it's the skin in your ear canal is very, very thin. It doesn't take much and to scratch it. And once you scratch it, you can open up an area for bacteria to get in. Of course, the longer that your head is underwater as well, you're losing that protective earwax. I know that's kind of a gross thought, but that's just the reality of it. It is. So how do we prevent it? Well, we keep our ears dry and we can use earplugs and bathing caps, which I'm not personally a fan of because I don't like the feel of it, but some people like that. Eardrops are my go-to personally. Basically, eardrops are commercially available at any any grocery store or pharmacy. They typically contain rubbing alcohol and glycerin. Those are the two key ingredients, and they're great at drying out that water and killing any bacteria that's in there. If you use those after swimming each time, you will not have this problem. All right, here's a list of water safety resources for your community. And starting off with NDPA, their website, Children's Healthcare of Atlanta has a great website. I'm also happy to send these lists out to anybody who attended. If you'd like that, just let us know. GAWatersafety.org is our website. Poolsafely.gov. Red Cross has some great resources under their Whale's Tales program. CDC Healthy Swimming site. National Water Safety Month. I forgot to mention that. Actually, this is National Water Safety Month, and today is International Water Safety Day. So that's why we're doing this. Underwaterhypoxicblackout.org has some great detailed information in there about that topic. Notoutofthewater.com is a good resource for clearing up a lot of the misnomers that Dr. Lazarus was talking about earlier and confusion about different types of drowning. There's really just one drowning. It's a process and depends on where you interrupt that process. The AOAP has a program called Respect the Water. That campaign is great too. If you Google that, you'll find the resources there. And then the World's Largest Swimming Lesson is also a great site. At this time, I would like to thank the Atlanta Water Safety Coalition, which is made up of GAWSA, along with Children's Healthcare of Atlanta, the American Red Cross, the YMCA's of Atlanta, and the City of Atlanta Parks and Rec for supporting this webinar. And we will open it up for questions at this time. And I would like to note that our organization, as well as CHOA and NDPA, are all nonprofits and all very worthy causes to consider if you're thinking about charitable contributions. But I want to make sure we've got some time for questions, especially for Dr. Lazarus, because I'm sure that there may be some questions for her. So if you have a questions, feel free to unmute yourself.
And Sarah McGuire did ask, is there a way, Craig, that they could get the slides after this?
Yes, for sure. And I see, it looks like, okay, somebody else asked about the resources. Okay, yes, we can definitely send, probably give me till tomorrow, but I can definitely get the slide deck sent out to everyone.
Perfect. Well, thank you so much, Craig. This was really great. And I think such useful information for anyone who is exposed to water, which is everybody. So,
Right.
The fact that this is the leading cause of death in ages 1 through 4 and people don't know it, we keep shouting it from the rooftops. And it's really important that people realize this isn't going away and we need to address these. So I'm also here to answer any questions that anyone has for myself or Craig.
Yeah, if we don't have a question, I'd like to just ask you, Dr. Lazarus, if you could kind of walk us through what happens when a child comes into the ER as a result of drowning. Like what typically would the steps be? I mean, how would that progress?
So because it's such a spectrum, we do have cases every year. We wait for this call, and unfortunately, we see children every week almost that are drowning victims. And it could be as minimal as they were pulled out and they have a cough. And in that case, sometimes we'll watch them for 4 to 6 hours, or they're actually having very little symptoms when they arrive. And because we know that drowning is a process, a spectrum, and that they're going to get sicker in the first 4 to 6 hours, if they have had a significant aspiration event, we will sometimes just watch them for 4 to 6 hours. And if they're doing great after that time, their lungs are clear, they're not requiring oxygen, then we know that they're safe to go home. But we also have children that come in that have significant brain damage, that are in cardiac arrest, that are intubated, meaning a tube down to help them breathe. And it's the worst of the worst.
Yeah, that's awful. Is it true that there's very, very little that can be done if someone comes in at that more severe point?
Well, there's no magic bullet to fix a drowning. Unfortunately, we just have to see what the damage is to brain and lungs. And so there's not a magic fix. I mean, we do have heart-lung bypass that we can occasionally do if everything else is okay, if it's just the lungs that are sick. But a lot of times, children are so sick that they may go into something called DIC, coagulopathies, their liver may get injured, their brain, and it kind of becomes a multi-organ system failure. And in that case, there is nothing we can do. And that's why these layers of protection, the 5 layers you talked about, are so important, because all the work that you have to do to help drownings really happens before they are brought to medical care. And I saw a really great, I think it was an NDPA poster that said, there's no one way to prevent drowning, but luckily there's 5. Those 5 layers of protection.
Right.
There's not one way that we're going to prevent a child from dying from drowning, but luckily there are these layers of protection. And if you have all 5 of these layers, they're very unlikely to drown.
Right.
And to have any injury from drowning. And we really at Strong for Life focus on arm's reach, eyes reach, which you mentioned. So making sure that a non-swimmer is within arm's reach at all times. And once they are a competent swimmer, you can move to an eyes reach supervision, but making sure you're not distracted. And I like to tell parents to go ahead and give their child a start of summer swim test every year and see where their child is with their swim skills, because they might not have the same skills they had last summer. They may have completely forgotten how to swim. And then be honest about those skills. If they're going to someone's house or going to grandma's or wherever, be very clear about where their swim skills are.
Mm-hmm. That's a great tip. Yeah. Any other words of wisdom that maybe we didn't talk about this evening? I know my friend Dr. Adam Kaczmarchi, he's the executive director of NDPA. He gets calls from families that have suffered a drowning loss on a regular basis, and the common thing that they say, or that he hears from them, is, we just didn't know. We didn't know that it could happen this quickly. We didn't know that it would happen that quietly. We didn't know that we just didn't know. And so that's why, Dr. Lazarus and I are so passionate about getting this information out there, because it's not as straightforward as everyone assumes. There's really more to know. And I'd love if anybody else has a question to please jump in.
Hey, Craig, Evan Nylander and Dr. Lazarus.
Yeah.
Thank you for sharing this. I've been around the water for 30 odd years, and I was learning quite a few things today. Craig, I'd love to get more information from you specific to that June 20th, 21st date offline, and get more of this information to be able to share with the swim league teams early season, but also just help broadcast this more.
Absolutely. Yeah, I think that would be wonderful, Evan. If there's we could definitely talk offline about that. Yeah, that's a lot.
That'd be great. Yeah, this was great. I think as much as it was helpful for me to cascade this to more of our neighborhood swimming programs would be a great start to the season.
Awesome. Any other questions?
Thank you guys all for being so passionate about this issue and being here and being the eyes and ears of the community and bringing awareness. And
Absolutely.
We appreciate you.
Definitely. If you have, NDPA has some other great resources too about in their toolkit. So if you go to ndpa.org, look at the water safety toolkit, and there are checklists up there that you can download for free. And some of the checklists are things like, how do I find a good place? What are some interview questions I should ask the swim school before bringing my child to your swim school? And sadly, there was a case think it was about a year, it was maybe 2 years ago now. Izzy Scott drowned during a swim lesson in Georgia. This was down, not quite in the Augusta area, I can't remember, Southeast Georgia. And the instructor was not following common safety protocols, but we have a new law now called Izzy's Law, and it requires that swim schools take proper precautions when they're conducting swim lessons to ensure the safety of everyone there. So this is just one of those areas. So NDPA has checklists on that. They also have checklists on when you're going on vacation, things to look out for, and questions you can look for and ask for if you're renting property, for vacation rentals, things like that. Sadly, we hear cases each year of children drowning while on vacation because everybody takes their guard down and they forget that the danger still exists there too. So if nobody has any other questions, I will wrap us up. But it has been a pleasure having everyone join us tonight. And thank you so much, Dr. Lazarus, for your time and expertise. And I'll be happy to send the slide deck out to everybody tomorrow. And if you'd like to reach us, my contact information is here. And then if you have a question for Dr. Lazarus, let me know. I can put you in touch. I know she has a very busy schedule and does not offer free medical care.
But I'm happy to answer questions. No problem at all. Thank you guys all.
All right. Thank you, everyone.